Our control room is the heart of our simulation center, and it has to work to make sure that we can provide the best user experience for our students that are going through simulation. Without our control center working properly, it'd be really hard for us to provide great learning opportunities for the individuals that are training in the center.
The simulation center is a new option to train learners, physicians, medical students, really any kind of healthcare provider in a lot of different things, not just procedures, but team-based approach to patient care. And it opens up a whole new way to train healthcare professionals. The vision of the new building really was for education. And the family medicine program has been in Midland and at this institution for almost 40 years.
MidMichigan Health came to us because of our relationship, and our relationship with them was doing their conference rooms and meeting rooms for a number of years.
Integration is key for both our healthcare devices that we have that integrate with our technology, but also to make sure that we can support the training objectives that we want to achieve in the future.
And initially we set up 12 rooms that way, and they can actually monitor those students at any of those 12 rooms at any time, audio, video-wise, and have full communication with the rooms as well.
This project to me was the largest project I've ever done. And it was really important to go to AVI-SPL because I trusted at the end of the day that the product would meet the scope that we designed.
I'd say one of the biggest changes in technology for us in our new office is how we do precepting. So we previously sat in a room and residents would come in and talk to us about their patients. And now they come into that room, but we have the capability of watching the interaction on video with audio and giving them then afterwards some feedback about how did this go, how did the interview go, how could you improve those skills.
Being able to film them and then play it back for them and allow them to see what's going on and what is actually going on in the room, because you're focused on what you're doing, it really helps them to see how they impact others.
I think being able to leave this scenario with a video where you can actually watch what you did rather than just try and remember what you did provides a benefit. You see what you did well, what you can improve on, rather than somebody telling you. There's a visual aspect to it, and then you have the opportunity to critique yourself in the process.
AVI really listened to the customer. They got on early and made sure that we understood the paging. Paging was critical. We ran that through user groups to make sure that the users actually were able to navigate through the paging and know exactly what was in the room and how it would be used. So the technology is a tool to help us provide the best training we can. Our presenters and trainers are educated, but we can raise the level of training by having the best technology that we have. This building, to me, is the gem of our organization at this point.